Hello, all. Welcome to the last part of Postmortem Changes. In this lecture, we'll try to know how to estimate the time since death or the postmortem interval. So, basically, time since death or the postmortem interval is the interval between death and postmortem. So, the time between death and postmortem is the time since death. So, during postmortem examination, it is an essential part to establish time since death, or the one of the most important objectives for doing a postmortem examination is to establish the time since death, or to know the approximate time of death. And you all know that time since death may not be at the same time of crime, because the individual may have survived for some more time after the crime. So the time of crime will not be the time of death. So usually in case of hospital death, we can easily know the time of death, or if there is an eyewitness also, we can easily know the time of death. But if it is not a hospital death, and if there is no eyewitness, it is almost impossible to determine or to pinpoint the exact time of death, or the exact interval between death and post-mortem examination. But uh, since we have studied the post-mortem changes in detail, we can have an approximate idea of time since death from the following changes: cooling of body, postmortem lividity, rigor mortis, decomposition, adipose formation, mummification. All these changes you have studied in detail, and these changes, or the data collected from these changes, can contribute to the estimation of postmortem interval. Some additional changes, like changes in the bones, changes in bone marrow, contents of the stomach and intestine, contents of urinary bladder, then some biochemical changes that happen in our body, and also circumstantial evidence. These data will be helpful for estimating the post-mortem interval. We will look into one by one. First of all, cooling of body. So after death, what happens is that the body loses heat by four processes, that is conduction, convection, radiation, and evaporation. And while doing so, the body tries to attain the atmospheric temperature. So various factors will be responsible for act as a alterants for cooling of body. So we have to consider all these factors, and from the data obtained from estimating the cooling of body, the external surface of body in India, or in an average in India, cools in 12 to 15 hours, and internal viscera cool in about 18 to 24 hours. This is uh, taken up by the fact that the average cooling in India is zero point 0.5 to zero point 0.7 degrees centigrade per hour. So we learned earlier that the time since death can be calculated from the data from cooling of body, that is by a formula: time since death is equal to normal temperature minus rectal temperature divided by rate of cooling per hour. The next data will be collected from examining the postmortem lividity. And postmortem lividity is due to the stagnation of blood in toneless dilated capillaries on the dependent parts of our body, and the body usually stains the color bluish purple due to deoxygenated blood. So postmortem lividity usually starts appearing after 1 hour, and it becomes established in our body during 3 to 6 hours, and the postmortem lividity gets fixed after 6 hours. And we can check whether the postmortem lividity is fixed or not by doing the blanching test. That is, if we press our thumb or any finger into the postmortem lividity area, it may blanch if the postmortem lividity is not fixed. And if the postmortem lividity is fixed, that is after 6 hours, it will not show any blanching. The next data we can collect from rigor mortis. So we all know that rigor mortis is due to the non-availability of ATP. Then it is due to the depletion of glycogen stores. The actin and myosin filaments of our muscle fuse with each other to form a gel, a compound, resulting in the softening, shortening, rigidity, and opacity of muscle. So, our muscles after death shows four types of changes. That is, the muscles will be shortened in length, then it becomes stiffened, it shows rigidity, and finally it shows opacity. So, in case of rigor mortis, it shows a 12-hour rule. That is, rigor mortis starts appearing about 2 to 3 hours after death or after primary relaxation. Then it becomes established in 12 hours after death. It remains there for about 12 hours and then passes slowly up in the next 12 hours. So there is a 12, 12, 12 hour. It became established in 12 hours. It remains for 12 hours and passes off in 12 hours. The next factor is about decomposition, and in the presence of moisture, air, and warmth. These three factors are responsible for decomposition, that is, presence of moisture, presence of air, and presence of warmth. Here, the body, that is autolysis, as well as the lysis due to the bacterial enzymes. The bacteria are anaerobic as well as aerobic bacteria. These act on the body, which results in the conversion of complex organic matter into simple inorganic elements. And the result is softening and liquefaction of the dead body. So this chain, that is decomposition, starts in our body about 2 to 3 hours and become manifest in between 12 to 24 hours and is fully established in 2 to 3 days after death. So we'll look into the changes that happen during decomposition. That is, in less than 1 day, there will be, or the most important or the primary change that happen uh, in case of decomposition is the greenish discoloration in right iliac fossa. Then there is intestinal distension, and houseflies, etc., lay their eggs in lateral orifices, wounds, and in body creases or skin folds. Then the changes of decomposition that happen in 1 to 2 days include the greenish discoloration that starts in right iliac fossa, uh, become spread into the whole body. Then there is a change called marbling, that is staining of the capillaries, which shows an appearance called marbling. There will be foul smell of decomposition. Then the bloating of the body starts due to the gas that is formed during decomposition. Then there is putrefactive blisters, which resembles blisters that occur due to scalds, and we have to differentiate between putrefactive blisters as well as blisters from scalds. Then there is a skin slippage established as degloving and destalking. Then there is pressure effects of gases, which causes blotting of the body, as well as the identity also will become very difficult. Then in 2 to 3 days, the whole body become discolored and bloated. There will be very foul smell. Maggots may be present after 2 days. Cuticles will be peeled off. Hair can be pulled out. There can be prolapse of rectum and uterus. There may be postmortem delivery in pregnant women. The wounds may appear to be bleeding again due to uh, because the blood become fluid again. So during decomposition, and wounds appear to be bleeding again. Then there is shifting of postmortem lividity because of postmortem fluidity during decomposition period. Then heart becomes empty, and there is froth and gastric contents present at nose and mouth due to the distension of abdomen or increase in abdominal pressure. Then the changes that occur in 3 to 5 days are: teeth and nails become loose and can be pulled out. The sutures of skull separate, so the liquefied brain may ooze out from the scalp injuries, and also liquefaction of internal viscera starts. The other late signs of decomposition include body cavities may burst open due to excessive gas accumulation. The body cavities may burst open. Then colligative decomposition of putrefaction or liquefaction of body occurs, and the whole of soft tissue liquefies slowly, and finally skeletonization of body occurs in 1 to 3 years, and the bones decompose in few to many years. And in case of body lying in water, in the absence of air, there results postmortem hydrolysis and hydrogenation of body fats to form fatty acids, which continue which combine with calcium and ammonium ions to form insoluble soaps. In 3 to 35 days, a change known as adipocyte formation. And in absence of moisture and excess of warm air, the body mummifies in 3 to 24 months due to dehydration. That is a change called mummification. Then the next changes is seen in bones, that is, a soft tissue of bones is lost after 1 to 3 months. The bone marrow is moist up to 3 months, and after 6 months, the bone marrow dries up, and in few to many years, the bones decompose. Then some changes occur in the bone marrow, that is the neutrophils, which is about 40 percentage in bone marrow, starts swelling 1 hour after death and becomes rounded in 4 hours after death, and fuse with each other 10 hours after the. These are the early changes that happen in the bone marrow. Then in the changes that happen in the contents of stomach and large intestine, that is gastric contents, the contents can help us know whether the last meal was breakfast, lunch, or dinner. So during autopsy, if we examine the stomach and its content and find out undigested food particles, we can know whether the last meal taken was breakfast, lunch, or dinner. Likewise, you can see or you can estimate the time of death. Then up to what extent of digestion happen after the last meal? So partly digested food occurs in or part digestion of food occurs in stomach in 1 to 2 hours, and gastric emptying time is about 2 to 6 hours. And though gastric emptying may be delayed in head injury, alcoholism, anxiety, and sleep. And the half-life of gastric emptying is considered to be 1 to 1.5 hours. That is, half of the gastric content will be emptied in 1 to 1.5 hours. So likewise, liquids leave the stomach almost immediately, and carbohydrates leave the stomach earlier than proteins, and proteins leave earlier than fats. So fatty foods uh, remain longer in the stomach, or gastric emptying will be slower when we eat fat rich food. Then the color and smell of gastric contents can help us to know the cause of death in case of some poisons, and also some presence of some capsules, tablets, some powders may be detected in the stomach contents. Then contents of large intestine, since majority of people defecate in the morning. So if the dead body shows presence of feces in the large intestine, that is an indicator that the death might have occurred in evening or night. Then contents of urinary bladder, since the rate of urine formation is 1.5 liters per day, or 1500 ml per day. The range is about 600 to 2.5 liter ml per day, that is approximately 1 milliliter per minute. So the amount of urine that is present in the bladder during autopsy indicates a time of death since the last act of urination. So we know that that person had the last, or we know the time of last action of urination, and uh, since that time, the amount of urine present in the bladder, if estimated, gives an approximate time since that, because from the last act of urination, 1 ml per minute will be the urine formation. So amount of urine in the bladder present at the time of autopsy gives an approximate indication of time of death. Then, regarding the biochemical changes that happen in our body, that is in the CSF, if we examine the CSF, we can demonstrate increased NPN, that is non-proteinaceous nitrogen substance, increased amino acids, increased lactic acid, increased potassium, ammonia, creatinine, and uric acid, and also decreased glucose and chloride. And in blood, the biochemical changes are increased NPN, or non-proteinaceous nitrogen substance, increased creatinine and lactic acid, increased enzymes like acid phosphatase, alkaline phosphatase, amylase, SGOT, gastric dehydrogenase, etc. Then there is decreased glucose, increased potassium, ammonia, phosphorus, magnesium, and bilirubin. And also there is decreased sodium and chloride. In the vitreous humor of eye, we can demonstrate increased potassium, ascorbic acid, lactic acid, decreased sodium, and glucose. In the pericardial fluid, the biochemical changes include increased potassium, then phosphate, proteins, and enzymes, and also decreased sodium. Now, the most important part for the estimation of time since death or postmortem interval, the evidence of an eyewitness will clearly demonstrate the time of death or the postmortem interval. And if the person is found dead, and if there is no evidence of eyewitness, and if he is wearing office clothes, there are more chances that the death may be in the daytime, or when the person was going to work, or coming back from work, or during work. And in case the dead body is found in a room, and if the lights are on, there are more chances of death during evening or night. And the pocket diary or the suicide note found on or near the body also gives clue about the time of death, that because there may be a date signature, or the pocket diary may show an entry on a particular date that may give a clue about the time of death. Then the pocket contents like letters, bills of purchase, receipts, cinema tickets, etc., also gives clue about the time of death. Then the lice in the hair die about 6 hours after death. So if we get live lice in the hair, that the time of death is within 6 hours. And due to retraction of skin, the facial hair appears to be growing at the rate of zero point 0.4 millimeter per day. So the beard hair may show growth of zero point 0.4 millimeter per day. It is actually not growth, but due to retraction of skin in the face, the facial hair appear to be growing. So the date on the mail found in the letterbox, or unattended newspapers near the gate also gives a clue about the time of death. Then the food lying on the table or in the kitchen, if examined, we can make out whether it was for a breakfast, or for dinner, or for lunch. This also gives a clue about the time of death. Then the automatic or ordinary watch may stop after 6 to 8 hours of death, and may indicate the date and time of death. Then if the body is lying on grass, and due to non-exposure of sun, the grass may become pale in 5 to 7 days. So if we remove the dead body from the ground, and the grass on the ground is pale, there is a chance that the body may be lying in that grass for about 5 to 7 days. And Another method for estimating the time of death is by measuring the radioactivity of carbon C14, which decreases slowly, and sometimes the dating of old skeleton by carbon dating is also possible to find out the time of death. So these are the data that will be helpful for estimating the time since death. This is a usually or a commonly asked question for your university as well as semester examinations. Estimation of postmortem interval or estimation of time since death, or can be asked as how will you estimate the time since death. So in this case, you have to write down the different changes that happen after the death, and from that data, how will you calculate the time since death? So we have to learn about two more topics. That is, the first one is presumption of death. That is, when to presume a person as dead or when to declare a person as dead. So declaration of person as to be dead is required in cases of inheritance of property, insurance claims, and pension claims. So the legal heirs or the dependents of that dead person will approach the court and plead the court to presume the person to be dead or declare the person to be dead. So this is explained in two sections, that is section 107 and section 108 of Indian Evidence Act. So as per section 107 of Indian Evidence Act, if a person is shown to be alive anytime or anywhere within the last 30 years, so for last 30 years, if there is evidence that a person has seen someone anywhere or anytime alive, the law presumes or the court presumes that he is still alive. And the burden of proving him to be dead is on the person who states that that person is dead. So, if a relative of a person is approaching a court to declare a person to be dead, and he has a burden to prove that the person is dead. Hmm? So, if someone, it can be anyone, brings a photograph or some evidence within 30 years that he saw that person somewhere alive, the court presumes that he's still alive. So the burden of proving that person is dead will be on the person who states that that person is dead. So if a person's identity or a person is shown to be alive within the last 30 years, the court presumes that he is alive. But if the relatives and friends allege that they have not received any letter or communication from him for the last 7 years, which they were receiving or should have received within the last 7 years, the law presumes that he is dead. And the person of proving him to be alive is on the person who states that that person is alive. And this is stated in section 108 of Indian Evidence Act. But court only presumes about the death of a person, but nothing will be said about the time of death. Then the next term is presumption of survivorship. And the presumption of survivorship is needed in cases of inheritance of property based upon will. That is, it becomes essential to establish who survived who, that is, who died earlier. If both persons or the persons are died in the same accident or same incident. So for estimating the presumption of survivorship, the uh, evidence that is recorded from eyewitness is very important. And in the absence of an eyewitness, the following are the guidelines which is presumed who survived whom. So if an adult and an old person or a child is involved in an accident or incident, the adult has a survival rate than child or elderly. Or the court presume that the adult may have survived longer than a child or elderly. And a male may survive longer than a female. These are the, some of the guidelines that are helpful to presume survivorship. Then healthy and well-built person may survive more than a week. Then regarding the extent of injuries, more the number of injuries and more the severity of injuries, the earlier will be the death. And death is earlier if the injuries are on the vital organs or major blood vessels. Then time since death may be established during postmortem examination by the different postmortem changes and the data that are obtained from the different postmortem changes. And regarding the type and cause of death, that is in starvation, females survive more due to their fat storage, and old survive longer. Then in asphyxial death, females survive longer, and in cold, adults survive longer than children and elderly due to the excessive muscle mass. Then in heat, the children and elderly survive longer than adults. Then in drowning, a swimmer survive longer, and in burns, if the if the percentage of burns are more, earlier will be the death. And burns on head, neck, face, or lower abdomen result in early death. And in case of delivery, mother survives the child. So these are the indicators by which court will establish presumption of survivorship. By this, we come to the end of part 4, or we complete the post-mortem changes. You have to study these topics thoroughly, because these topics are a favorite among the examiners, and a lot of questions will be asked for your university as well as semester examinations. And study well this topic. Okay, thank you.